most famous physical therapist on the internet.
Thanks for joining us. Hi, folks. I'm Bob Schrupp, physical therapist.
Brad Heide, physical
Did I
therapist.
throw you off? Together we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
How to stop sciatica without difficult exercises or doctor visits. Big problem when you get sciatica. That's
Right,
life-changing.
right.
Really can affect your job and your relationships. And
Oh, yeah.
by
Bob,
the way, if you're new to our
yeah.
channel, please
Carry on.
join us on our social media channels if you get a
Oh,
chance, because we're
yes.
always giving away something, except for today. No, tomorrow we're going to be giving away something. If this goes up on a Saturday,
Sure.
by tomorrow we're going to be giving away a sleep ovation mattress.
Oh, and they are deluxe.
Yeah, they are deluxe, and that's going to help you with your sciatica too, right?
Oh, absolutely, Bob.
So
but
go to bobandbrad.com, go to giveaways, or it'll be pinned to the top of our page on Facebook.
you better believe it. So, Bob, I'm excited about doing this video because in the last week I had two patients. Both had sciatica. One's in her 30s, the other one's in her 50s, just about 60 our age. And their symptoms were similar, like sciatica symptoms are, back pain going down the leg. They weren't really flared up. Now, this video will help if you're really flared up to a degree. But if you got sciatica that's there and it's kind of on and off and you're kind of wondering, what am I going to do to get rid of this? This is a good video for you.
Yeah, this is good advice for anyone who has sciatica.
Yep.
But I think what Brad's saying is, with some of you, if it's really severe, then you may have to do certain exercises.
Right. If you can hardly walk up straight and you're
Right.
really limping, you're going to have to see a different video because this is when you're improved a little bit.
Right.
Okay. So again, with these two patients, like I said in the last week, I saw them both. We got to get this information out to everyone because it's very consistent with sciatica people. The one thing is if sitting bothers you, if you're just sitting for more than 5 or 10 minutes or long term in a car and you're getting that pain, it's going down your leg and you think it's because the chair's hitting you here and you're adjusting things and getting out of the car, it's like, oh, it hurts. And then you walk around a bit. And then after walking for a while, it feels a little bit better, or just chairs in the car, whatever. Seated and getting up from the chair, this is going to be key for you.
Now, quite often, back pain and sciatica are a seating problem more than even a lifting problem.
Sure.
I mean, because we sit so much now, and it just affects the disc. We won't get into that, but you need to make adjustments for your proper sitting,
right,
to obtain proper sitting.
So first of all, instructions to both of these patients were, do not sit in your sofas or your recliners that are soft and cushy. Bob, you're going to grab a chair, a nice firm chair, upright chair, that's going to help keep you in an upright posture.
Yeah, if you're on a soft couch or a recliner, you're automatically going to go into that rounded out position. I mean, you can sometimes, if you're forced to, you can put a throw pillow behind you, and that'll help. But generally, too, the problem with sofas, too, is they're low.
Right.
Especially for me.
Right.
So then your knees are up, and then you're definitely going to round out your back. So yeah, a good solid chair. This is what I actually sit in for at work. I like it. It's just good upright back that,
upright,
hits me right.
Firm chair. The next thing, address the car sitting situation, and probably going to need a lumbar support. You can start out with a towel roll. You don't have to go out and buy one. We have our famous towel roll here. And here we got a car seat. And you're going to put it right at the level where you have the problem. And you'll know, because if it's in the right level, it's going to say, oh, that feels much better.
Yeah, generally it's around the belt level.
Yep.
And what you'll find is that I have found, and generally people with sciatica, a lot of times they need even a bigger towel.
Sure.
And then as time goes on, you can get by with a smaller one, rolled up smaller.
Right.
But
you'll know.
Yeah.
You'll know,
it should feel better.
Right.
I mean, if it doesn't, you don't have the right size.
Correct. So there's, once you've, if you want to purchase one, they work a little bit better than a towel roll. There's no doubt.
Well, one thing, they have the strap. So you don't have to always be taking this thing and putting it behind your back.
There, and this one for me is too big. I can feel that. But make sure you address this. I have people use a throw pillow. I have them use a towel roll, and then as they get what they want, they'll purchase one.
And make sure your seat is somewhat upright. You want to show Brad what happens if it's not. Yeah, right away what he's going to do if it's not.
If you're driving,
look how he's going to round out. We want the back as straight as possible. And the only positive thing about sciatica I can say, Brad, is that generally if you are in a bad position, it lets you know.
Right.
You know what I mean? It punishes you. So you want to remember what it is that makes you feel better. And those are the ones you want to repeat. And generally, it's good posture.
Right.
That's the direction you want to go.
The next thing, body mechanics, posture and standing. So I have people say it just kills me to do their food over the countertop or on their workstation. They're working at a bench that might be a little low, and they don't understand why it bothers their back. But oftentimes they'll be working on something and or brushing your teeth, and you're slightly flexed forward because you're looking down and you're not aware of it.
Right.
That little bit of flexion forward can pretty stress the back, and if you got sciatica, it multiplies that, and down the leg it goes. So look at that posture, keep upright as best you can. One thing did you want to say something, Bob?
No, the only thing I was going to say is there was times when I had a bout of sciatica when I was younger, I actually stood and did my notes.
Sure.
Because I didn't want to sit. I avoided sitting as much as possible.
Sure.
I found a countertop that was high enough for me. Yeah, generally, you want to keep things between kind of your hips and your shoulders. This is a good work area here.
Sure.
If it's lower than that, you're going to bend forward.
Right.
So.
Right. One thing you can do is you can find a stick about 5 foot long. We like the Booyah stick because it works really well, but you don't have to have one of these. As long as you have, I've had people use a broomstick, take the broom part off, and you put it so your head touches, it touches your mid-back, and
3 points of contact.
Your bottom side right there.
Yeah. Here, and here.
Right.
And this is going to teach you the way your back should be when you do things.
Right.
So you can practice actually, bending forward and trying to lift something up with the Booyah stick in place.
And both of my patients I referred to, this is one of their exercises. This is going to teach them good good posture. And then I have them do squats like this. So it teaches them good body mechanics so that when they do pick something up off the floor, they do it without irritating their sciatica.
Yeah, you want that to burn it into their brain, basically.
Right, you want that muscle memory, good habits. And I'll have them do 10 of these. 10 of those, and you're getting stronger as well. So it's a double win.
It's like you said, it's strengthening the right muscles.
Right, exactly.
For what you want to use.
And then the last but not least, both of these people, I said, how does walking go? And they say, well, once I get going, it feels better. So walking, as long as it feels good, you're going to walk on flat. Don't walk on hills or downhills, or if the road is curved, nice even surface is the best.
I had a friend that worked at a back clinic, a fellow physical therapist, fellow physical therapist, and so that's all they saw, back patients. And the number one thing they do is try to get them walking first.
Sure. Yep.
I mean, they'd come in and it's amazing. Like you said, it might hurt a little bit at first, but it starts to feel better. That's really a good sign.
Right.
And you may want to take shorter strides. You don't want to stride out real long because that might hurt the sciatica.
Comfortable walk.
Yeah, comfortable walk, short strides, and if a cane or a walking stick helps, go ahead and do that, because if you can walk, it's going to help heal the spine.
You'll know, because if you're walking and it just is irritating that's not the right thing to do.
No, we don't want to keep it hurting. And you got to make sure you might even have spinal stenosis or something instead of normal sciatica.
Sure. So get your walks in, not too far. I always have people have them walk around the block as opposed to out and back, because if you get out a mile and you got to get a mile back and it's hurting for whatever reason, it's a long walk back.
It's like the old joke about the swimming the English Channel. The guy swam halfway out and he got tired, so he swam back instead of going all the way across.
Bob,
I thought you'd enjoy that one, Brad. Yeah. All right. Remember, Brad and I can fix just about anything
except for
a broken heart.
There you go.
But we're working on it day and night.
You bet. Good luck with that sciatica.